There's something that's helping to reduce opioid overdose deaths. It's a drug reversal agent called naloxone. Naloxone is safe and rapidly reverses an opioid overdose. Naloxone is not a controlled or illegal substance, and it has no effect on an individual unless they are experiencing an overdose. In other words, you can't harm someone by administering naloxone, even if they're not experiencing an overdose. Naloxone is the official name for the drug reversal, but most people are familiar with the name Narcan, which is the nasal spray. The two are basically the same. The difference is just how they are administered. Narcan is a nasal spray and naloxone is injected into the muscle. Police officers, emergency medical technicians, and first responders are trained on how to give naloxone. And it can also be administered by basically anyone. The nasal spray is the simplest form to administer. Simple training can also be provided for naloxone to make you feel more comfortable administering it. Want to hear something scary? People are more likely today to have to administer naloxone than they will be needed to assist with first aid, CPR, or an AED machine. Everyone should basically have naloxone nearby and let people know where it is. People should still call 911 immediately in the event of an overdose. In some areas, you can get naloxone from pharmacies with or without a prescription, from community programs or local health departments. The cost varies, and you can use or not use your insurance for coverage. With some insurance, naloxone is free. But what does an overdose look like? Here are some signs of an opioid overdose when you may want to administer naloxone. Unconsciousness, very small pupils, slow or shallow breathing, vomiting, an inability to speak, faint heartbeat, limp arms and legs, pale skin, purple lips and fingernails, drug paraphernalia present. We also want to talk about a myth that Narcan or naloxone encourages drug use, but in reality it's only used as a last resort to prevent a fatal overdose. When administered, it brings a person down from their high, and it's only used when risk of death is a high probability. What's important to also remember is that carrying naloxone is like carrying an EpiPen. You don't anticipate you're going to use it, but it's there in case of an emergency. And lastly, the reality is that we aren't going to stop everyone from never using drugs. So we need to get people to use as safely, educated, and informed as possible. And again, the reality is that most of the street drugs nowadays contain fentanyl. To save lives, fentanyl test strips are available. The strips help the user know if fentanyl is present in a substance. If fentanyl is present, the likelihood of having a fatal overdose is extremely high. Testing the substance prior to using to see if it has fentanyl present or not, combined with having naloxone on hand and not using alone, will save lives. When a person regularly uses opioids or illegal street drugs, they might be diagnosed with a substance use disorder, or SUD. This diagnosis is the first step towards recovery. We'll talk about that next.